was in, there was some kind of lawsuit and he was called to testify. He's like, I don't even know what I'm testifying about, but I have to go into this. He got subpoenaed yesterday, so he wasn't very happy about it. But so it's 10
I'll get
o'clock. We
started.
can start up. And I've been keeping a little attendance here. Looks like everybody's here. Is Trenton here? Let me just. Trenton's not here. That's fine. All right. So we'll just kind of jump into where we were last week. I think we just got to um, systems under 2,000 gallons per day for subdivisions. We just started to hit on that. Does my recollection seem correct to you guys? All right. Screen. Yeah. Nope, head to the right page. Sorry. All right, so Jim, if you want to kind of walk us through, are you going to be able to do that without glasses on?
Yes, I will be able to do that.
All right, great.
Concerning subdivisions less than 2,000 gallons, obviously, again, we need to know what the proposal is going to be, because in the Chatham Health District, we base our fees based on the proposed number of lots that the subdivision is having. Okay, so they might start out. I've done a 40 lot subdivision roughly, and at the end they only got 36 lots. So you want to propose how many lots you can get. That's what we base our fee on. And the fee in the Chatham Health District is $145 a lot, which up to 5 test pits. Then after, if we do more than 5 test pits, then we charge an additional $45 for each additional test pit. So we get the
How,
proposal. Go ahead.
how long does it take you to look at one lot, 5 test pits?
Well, that is that's the $64 question. Again, it's based on the soil competition, composition. Look, I might be unique. I like to go down 6 feet for a test pit. If you can't determine what the soil conditions are in 6 feet, I mean, I know other towns and health departments, sanitarians like to, oh, we need an 8 foot test pit. To me, go down 6 feet. If we need to go any deeper, then we can go deeper. But it all depends on the soil types, Matt. If it's if there's many different types of soil layers, it's going to take you a little more time to read them. If there's high groundwater, then it gets really messy, because then if the test pits start filling up with water, then you're not seeing the soil layers that are down below the water level. Now, the easiest test pits to do are shallow ledge. You hit ledge, 2-3 feet. Man, that makes your day a lot easier. But then that opens up a whole nother can of worms for the developer. So it all depends on the type of the soil conditions are there. So if I can do 6 lots a day, maybe 8 lots a day, that's a successful day. Because now not only are you reading the test holes, now you got to truck through the woods and stuff to get to the other test holes. And if you're looking at minimum 1.8 acre lots, 2 acre lots, that's a lot of walking. So, if I can get 6 to 8 lots done in a day in a 6 hour period, I would be happy.
Yeah.
So then we do the soil testing, and then the engineer landscape surveyors will then plot them all out, and then we'll see which ones of those test holes are suitable for a septic system. If we hit shallow ledge, I mean, is less than 4 feet. So if we hit ledge at 3 feet or 2 feet, we're not going to approve that proposed lot. The developer then is going to have to stake out the septic system. They're going to have to remove the soil. They're going to have to bring in the select sand fill, and then we have to retest to determine that there is 4 feet of suitable material for that area in order for us to approve that lot. Maybe there's other health departments, sanitarians that look at the public health code and see that you need 2 feet of natural occurring soil. Right, that's part one to determine suitability. You need at least 2 feet of natural occurring soil over ledge, but in order to be suitable, you have to determine that you have 4 feet of suitable material over ledge. So here in the Chatham Health District, if we come across that, we don't approve those lots until it's been demonstrated that you have 4 feet of suitable material over ledge. So then after we do all the soil testing, Chatham Health District, we're not doing the perk tests. We're not carrying all that water and digging all those holes. So the perk tests are going to be done by the engineering firm in charge, and then we go from there.
You usually want to see one or two perk tests, or do you guys just take the engineers?
We take the engineer's word that they're professionals. We're not going out there and looking at the depth or do they put in 12 inches of water or not? And that's always been a big bone of contention. The technical standard says 12 inches of water. You get some of these perk tests, and you can see that they put in a lot more than 12 inches of water, which even makes our job a little more difficult in the review process.
Yeah. So then you review the plans.
Yeah, so then the plans come in. We charge, even though we charge per soil testing per proposed lot, we also then charge a review fee for proposed lots. We and go back to Bob's scenario maybe last week, how do you design a subdivision? It was up to me. I encourage the developers to look at designing these lots for a minimum of a 4-bedroom house. If it's a 4-bedroom house, I think that pretty much covers the gamut of the majority of houses being built today. And I've been looking at telling engineers for a 4-bedroom house for a very long time. I think 4-bedroom house gives you a lot of flexibility to have a 4-bedroom house and less, and then if they want to update to maybe 5 or 6 bedrooms, usually those lots can handle that. So once the subdivision comes in, we have to review each and every lot. I make sure that the soil data that's on the plans match the soil data that I collected. I make sure that the perk tests were pre-soaked and conducted right for the perk test. Review everything. Make sure that the septic tanks, the leaching system, the wells all meet the proper separation distances. The calculations for the square footage based on the perk rate and the proposed number of bedrooms. MLSS calculations, make sure that the system is the right minimum length for the leaching system, and describe what type of system they want. I don't want you to show a 50. The MLSS comes out to be a 50-foot block, and you just put a 50-foot line on there. I need to know what type of leaching system you're proposing. It doesn't have to be the type, but at least the square footage per linear foot. to make sure all that is in compliance. I don't dive into elevations and stuff like that because that's not required at the time for the subdivision plan. And then review it, make any comments and any changes, and then we go from there.
Then it goes to planning, zoning, wetlands, and through that process.
Yeah, we try to, yeah, I'm simultaneously reviewing reviewing the plans even before, you know, they might go to wetlands, they might go to planning, even though more for informal, to talk about the subdivision. But then again, planning can't really approve anything until it gets zoning and the health department's approvals. I mean, I apologize, wetlands and zoning, and even the town engineers got to get involved too if there's anything to do with the town roads. And as if you guys know, if you're coming off a state road, then we have to, you know, they have to get all their proper permits through DOT.
Jim, could you give us an idea of what your time frame is for that review process as well?
Well, again, it's a lot. You know, it all depends on the number of lots. To go back to the soil testing, if I know it's if anything's like I don't know, 4 or more lots, I will ask one of my fellow sanitarians to come out and help me review that. But again, it's hard to tell the time frame based on the number of proposed lots. Now, obviously, I just recently reviewed a 10-lot subdivision versus a 36 lot subdivision that I had to review a couple of years ago. And obviously you can look at, it's definitely a third less time or two-thirds time more to review a 36 lot subdivision versus a 10 lot subdivision. But I got to review, every lot, all the proper separation distances are maintained for the wells and septic systems. The town of Hebron, it was in our health district, has this lovely zoning regulation that says they want the wells a minimum 25 feet off the property line. And that, you know, I don't look at that, and we don't look at that because that's a zoning regulation. But those are things that could hinder, you know, stuff upon the review. So a lot of. I mean, even maybe the state would prefer that the well radius be on the entire property that it's serving. Yes, I understand that. It's preferred because once that well radius goes off the property line, then you might be looking at in the future where a well exception is going to have to be made for a neighbor's septic repair, and that opens up another can of worms. So. Bob, to give you a time frame, it's tough because it's based on the size of the subdivision and how well the engineering firm divides it. I swear that I think sometimes they hand us a bunch of cow poop, and then they want us to make it smell like a rose after our review.
Jim, I just did a subdivision. Well, I'm doing a subdivision, and by the zoning regulations, I have to prove that all 26 lots that I want to build have appropriate septic, you know, and reserves. Fine. I also had to prove that if I went conventional, all of the 26 conventional systems had to meet it as well. So we had to take the health department out. We got them 2 days a week for 5 weeks to dig all these holes. It was crazy. It was a horrible burden on them. They didn't really want to help us because we're taking them away from everything else they're doing. You know, so, you know, they basically spent, you know, a month working on our stuff, a little over a month working on our stuff. And it was ridiculous because the town makes us prove that the conventional will work, that you can actually get all 26 of those on a conventional layout. And then we do the open space, which is preferable to almost everybody. And then we have to prove that those 26 can actually get it as well. It's crazy. Is that something that is normal to you, or would you flinch at that?
No, I, I don't understand. Look, we try to keep, or the engineering firms, we don't locate and we don't go out and say, do a test pit here, do a test pit here. That's predetermined by by somebody else. But hopefully they, the regulations, they try to maybe do the soil testing in one area where it could compensate for both. But I think it's here in the town of Colchester, it's I think they know what they have to do ahead of time with the type of subdivision. If it's going to be open space, you know, based on wetlands, and they want to make smaller lots, they know that ahead of time, and everything is geared for that. So they don't usually have to do, you know, come in with two types of different submissions of plans. They know what the town wants ahead of time, and then we move forward with that.
Any other comments on subdivisions for systems less than 2,000 gallons?
Yeah, Matt, I've got a couple of thoughts that maybe Jim can help us with. So yeah, I think in Matt, in your situation, they're trying to determine whether or not you can justify the 26 lots in this in open space subdivision, but they don't want you, for some reason, they don't want you to get it like a density bonus more than you would have as a conventional. A lot of towns are that way, which doesn't really make any sense. And you're right, it does make your job a lot harder when you're on a septic than if you were with sewer doing the same calculation, because you wouldn't have that issue. You just show them that the math works for lot sizes and areas to build outside of wetlands and things like that. Um, Couple of questions, Jim, and because you've been, I think, doing this a long time, this is helpful to have this conversation with you. I have found that the reading of test pits is somewhat subjective and really, um, I guess, based on the expertise of both the engineer and the sanitarian, or both. That there are some guys that just, you know, they see soils and they know exactly what it is. And I've seen engineers and sanitarians go at, you know, heated battles over whether they're really seeing mottling or just a seasonal high water level that's causing some rust nodules around certain soil types and rocks and things. And without just having an extensive background, and expect, especially when you're in an area that you're familiar with, where you have different soils than, you know, I might have where I'm building or something, but you know, you're familiar with your towns that you're working in, you kind of know the soil types. And I'm just wondering, like, is there something that we could do, or is there proper training available already to educate both engineers and sanitarians on the proper reading of test pits?
Well, for many years, this yeah, DPH, along with I think CHA, have developed this soil class, a 2-day soil testing class. And the first one occurred in Marlboro at the Smokey the Bear place. And then after that, I think it's in that deep place in, I think, Burlington. It's a 2-day class. But if I had my dreaders, who I want in the test pit with me to read soils, it would be a soil scientist. And I would take a soil scientist word over a PE any day. And that took me a long time to adapt that that philosophy. So, and you're right, it's a 2-day training. The training cannot train every sanitarian that's you know, phase 1, phase 2 subsurface in order to go there. So a lot of that has to be maybe trained on per the health department itself to try to train their sanitarians. But it's a lot of training for soil testing. And again, you think about these soil scientists, they go to school for 4 years to learn about the soils. And now you want a sanitarian that just passed their RS exam, and how much soil testing and training have they gone? Even if they did go to the outstanding training that DPH and CHA has done in the past. So it takes, just like anything else, you're learning out on the job site, and you're right. Matt and I can go down into the same test hole, and it would it would be wonderful if we could read it the same, but we might get something different out of looking out at that same soil profile, that same test pit, based on our education and knowledge and what we learned in the past. But I would have a soil scientist out there reading test holes in a heartbeat.
Matt, you have something to add?
Yeah, I definitely got to chime in on this. So, when we're reading the soils, we're not expected to look into that much detail as far as what a soil scientist would do. The important things for us are identifying restrictive layers, and specifically, that would be the most difficult one would be obviously the water table, where the water table is. Ledge, obviously, that's a restrictive layer. That's very easy. Either it is or it isn't. So, there shouldn't be discrepancies when it comes to that. Now, there is a process for that in terms of if there's a disagreement between the engineer and the reviewing authority, which in most cases would be the local sanitarian, occasionally if I'm out there as well. And what that is, if there is a dispute, it's not a perfect process because it's time dependent. It would be actual groundwater monitoring. So you would have monitoring pipes throughout the wet season if there was a dispute. Now, obviously, we try not to do that because we're trying to be mindful of, obviously, people have projects and they want to get things moving. But for the most part, those things should get hashed out in a fair manner. I would say, though, on Jim's part, though, there are certain soil types, specifically, let's say shoreline communities, where it's hard to discern these restrictive layers in sand, essentially. Those I have actually requested a soil scientist because that was something that you really do need the expertise. But for your average soils, if the sanitarians have the proper training, they can get that right. To Jim's point as well, we would, and I think part of this is would want to do that soil training on an annual basis, and even more so, we would like to incorporate that into our phase one and or phase two training. In other words, make it mandatory. We just don't have the resources to do that, the funding to do that. More specifically, CHA has taken that on. We usually try to assist with that process and throw in, if we had it at a certain time, we did have some minor funding we can throw in there. But yeah, I think as a group, that would be something we should be recommending. Better training, field training, which would be specifically reading the soils. We have this process. We just have to be able to implement that on a more consistent basis, which would mean we'd want to have proper funding. And hopefully, part of this group, on my recommendation, again, for this group to put forward is to request that. And the good news with it is we do have this thing called the Soils Training Workshop. So we actually have this thing in place. It's just a matter of getting the funding set up where we could routinely do this. The other thing I will just say real quick is the unfortunate thing, how this has happened historically as far as training as well, was most health department had somewhat of a senior person there that would take the younger staff under their wing and take them out. Unfortunately, with the great retirement and also with a lot of moving around of staff throughout the state, that is not happening now. And then you take that at the same time that my office, which by the way, guys, I was supposed to provide you, and I have it actually. I'm going through my leadership right now to get it approved. What my program actually does, but we went from 85% of my program duties to sewage down to 50%, which is going to be shown in this document that I want to share with you guys. So that at the same time that the sanitarians don't have a senior person in their office helping to assist, we're pulling back. We're not doing the field visits as much, which oftentimes when we do that, we can sort of offer a rudimentary training on the job kind of thing. So that would be another thing to mention but you'll get my programs responsibilities later on, but that's the reality of the situation, what's happening right now with the training. It's more training is needed to get consistency across the state and to get people making the right decisions and not having someone, design a system because they think a water table's there and spend tens of thousands, if not hundreds of thousands of dollars more than they need to because somebody misread the soils. So I hear you guys.
Matt brought up a great point. If you developers have never been involved in the groundwater monitoring program, then you're looking at a 6 months, 6 months, hiatus, because starting February 1st until to May 31st, unless the state extends it. But for now, let's look at February 1st to May 31st. You got to do groundwater monitoring. You're looking at weekly monitoring of these ground monitoring wells. One above the proposed leaching system, one downgrading of the leaching system, and then weekly monitoring testing. And then there's a certain way to put in these groundwater monitoring wells, and that's outlined, I think, in the design manual, which you just take a perforated pipe and you go and you put it 3 feet into the ground and put some, gravel around it. You take a 5-foot pipe, cut it in half, 2 feet of it sticking out of the ground, and you have to you got to set that up. So, that is a long and tedious process, for groundwater monitoring to occur, and that's time and money.
So how disruptive is let's say I came into one of your towns with a 50 lot subdivision that has water. I have city water, but I need septic. How disruptive is it to your local health department to now service that through the approval process, but then through the build process when I'm building 10, 12 houses a year?
We would have to adapt and provide those services. Building code, when you come in with an individual lot, building code says they got 30 days in order to issue out a permit or a reason why the permit is not approved. And that opens up another can of worms. But usually, if you're coming in with a lot from the subdivision, we already did the soil testing. It shouldn't be that hard, and we don't have to worry about a well now. All we got to worry about is that you got to be 10 feet away from the public water system, and then just review the leaching system. So as long as your engineer, again, if your engineer submits a perfect plan, then our review is a piece of cake. But if the engineering firm doesn't know what they're doing, and we got to do all these reviews, that takes a lot more time. So it all depends on. And I'm not perfect, I miss things. So, but it all depends on what is submitted. The best plans being submitted makes it for an easier, quicker review for approval.
Go ahead, Bob.
Yeah, Matt, I would say absolutely that coming out of this program for our group is going to be, suggestion for some sort of funding. And I'm thinking both for DPH, but also maybe for the local sanitarian so that they have the staffing and resources to send their folks. They can't be pulling people out of the field for multiple days. I don't know how long that training takes, but, you're pulling them away from their daily duties when we take them to training. So we have to figure out some way of compensating them both for the cost, but also just the time commitment to do that training. But I think that's definitely something that should come out of our group. No question about it. It's just, like I said, I think at a previous call, I'm shocked at how small your group is that's focused on the septic systems, along with the other hats you guys wear just in your particular department. So definitely something we want to do.
Yeah. And honestly too, Bob, we actually have like a tremendous detail, like specifically even dollar amounts. We've listed. I have Amanda Clark. She's wonderful in my program. Very detailed grant requests. Like it's already done, so it's not like we'd have to. Literally, the paperwork's there. It would just have to be submitted, and somebody would say yes, and we have the funding for it. So, yeah, thank you.
Yeah, if you're open to sharing that with the group, maybe that can be part of our presentation or recommendation back to the full group of this is what we're looking for and this is how we think it needs to be done and what it's going to cost. So we can put that right into our final report or suggest that be incorporated into the overall report.
Okay, I obviously have to go through leadership, but I can
Yeah,
certainly get that together. I think that's a great idea. Thank
yeah.
you.
Okay. Just two, if you don't mind, just two other quick things that have come up. One was just something that Jim, as you were going through it, the whole concept of naturally occurring soils, the 24 inches, which I know is a requirement for DPH, but not necessarily for deep systems, which is sort of odd. That they can build above, they could fill everything above ledge, I think. If you had ledge on grade, you could build 4 feet above. I don't know if that's exactly true, but I know that you guys are very specific. So is that something that we should be looking into? And that may not even be our group in the process and funding aspect of it, but our overall group should be looking at that and whether there's a good valid reason from an engineering standpoint that that's the case.
Well,
Uh,
I think that is, right now, that's a public health code requirement, in section 1913B103. You need 2 feet of natural occurring soil over ledge, and then you have to have, 4 feet of suitable material over ledge. So if you have ledge at 18 inches, that makes that area, unsuitable. But that is more of, if ledge is at 2 feet or greater, that is a time constraint, because now you got to stop the process, and then you got to bring in extra money for the fill in order to determine that 48 inches above ledge. But I think that is more of a policy thing versus our group, which is more of economics. My only concern about is that a couple of years ago they were talking about making health counties, that line up with the planning counties, the 8 planning counties that are here in the state of Connecticut. So we could be walking a fine line about this funding if we go start turning into more of a county governmentship than individual township government. But again, I don't know where the funding is going to be coming from, other than from the taxpayers, tax dollars, and other type of grants that are out there.
No, go ahead.
Yeah, so just to go specific with Bob, that actually a question that came up yesterday. Honestly, that's pretty much a no-go zone. In other words, the naturally occurring soil thing, and here's why, and why DEEP allows it. You wouldn't want that. We have a prescriptive code. So DEEP, it designs by specific sites, and that's one of the reasons why the review process is so onerous, is because everything is designed specific for that site rather than just a code book that's just a check boxes and things, which is what we have. So if we did go that route, we would have to turn more into a non-prescriptive based code, which is, again, that's not what you guys want. So I would say that there is a process for that. If you want to do a site that basically is unsuitable per our code because you don't have those conditions, you go to DEEP, and that's because they have engineering. The level of engineering is specific to that site, and you got to go through that process. So I'm going to say that's not. That wouldn't be a possibility to consider with us. You can't have both. You can't have a prescriptive code and have that kind of thing being proposed.
Okay, I follow you, Matt. I guess my only comment back to you would be, how did we come up with a 24-inch depth and not 18 inches or 30 inches?
Yeah, that's a good question. I think it was, on a somewhat random basis. The only thing I can say is, it really has to do with renovation potential, if you want to get specific on it. So ledge rock, believe it or not, if you ever are going to see, which I have personally never seen in all my almost 30 years now, of a septic system or a well truly contaminated by a septic. I'm not saying it doesn't happen, but it's extremely rare. When it does happen, it's usually ledge related. Why is that? Because you would think, well, geez, what if it gets in the water table? Well, believe it or not, when it gets in the water table, which just means a saturated soil, that there's still renovation going on. There's bacteria colonies. It's under anaerobic conditions, but there is renovation. Whereas when you have ledge rock, you have cracks in the ledge. These are open fissures that go right into where these wells are tapped in. So you get zero renovation. So ledge is actually more of a concern when it comes to groundwater, specifically well water pollution, than of a high water table. So with that said, the natural soils themselves in a natural state, they have I guess they probably came up with something to the effect you need at least 2 feet of this soil for the sewage to go through of the natural soil in order to get that renovation, or at least some level of confidence that we have that renovation. So I think that's probably where it came from, and I would say probably other states are fairly consistent with that, if not even more conservative, to be honest with you. Like, just to give you one quick example, it's not ledge related, but like Massachusetts has a 5-foot separation from seasonal high groundwater. We have 18 inches. So that's like a significant difference. And it's all over the place. I think 18 is one of the lowest you will find in the country. I think Maine for a while there had the lowest of 12-inch separation to groundwater. I don't think I'd go there.
Okay. Thanks, Matt. I appreciate the explanation, and I think we'll leave that to the experts in the other committees to really decide if this is. Sorry about the phone. So that's fine. I do have one other thing, and this may be a little bit controversial, but I'm curious. And Matt, you sort of alluded to this a little bit with talking with Jim about just how, especially a larger subdivision in a local health district, may affect their capacity, especially with other things that they're doing. You got restaurants and you got 100 other things you're doing on your plate, and then all of a sudden somebody walks in with 50 lots, and you're one staff person or maybe two or something in a small group. The health districts are probably a little better from a capacity standpoint to move people around. But Deep has a program for environmental review, and it's a self-certification process. I think it's called Licensed Environmental Professional Program. And I was wondering if we should at least look at the possibility of having some sort of a self-certification process for maybe not all septic systems, but at least ones that are for single-family homes, or maybe just the subdivision aspect of it where we could have the engineers with proper qualifications certify, especially in the subdivision where we have this two-step process. You're approving the concept that is suitable for a septic system, but then you're going to again have to come back with the final design once you design the actual house and everything else that goes along with it on a site plan. Is that something that we could consider? And what I'm thinking of is it speeds up the time frame potentially. It reduces the workload on the local health district, and maybe there's even some cost savings there. But we really put the onus on the engineer to first be qualified to be doing this work, and then secondly, to basically sign off and say he's responsible. As you said, Jim, you're not checking elevation and things like that. You're relying on them to do their job properly. So is that something that we could consider as a possible way of reducing your workload, but not reducing the quality of the installed systems, I guess?
Well, what I meant about elevations is more for subdivisions, okay? But when it comes to an individual lot, yes, I'm checking elevations. I'm interpolating with the scale between the contours and where the leaching system is. So elevations are definitely checked on individual lots. Maybe Mac can step in, but I think that means you're going to have to change the public health code. I think the public health code states that the director of health or his agent has to, we have to sign off and approve an area of special concern. So if the soils are an area of special concern, a PE needs to design it, and then so that would require a change in the public health code for your idea to kick in.
Yeah, I'm gonna have to chime on this. So that would be a significant fundamental change in the whole process. But listen, I mean, I would be open to anything, but let me just outline this. I'm an engineer myself, so I'm gonna start criticizing engineers for a moment here. Um, so first of all, they're not perfect. I've personally seen many times when a lot of these private engineers are just doing a million jobs at once. And unfortunately, I've seen it. They're relying on us and the locals to pick up their mistakes many times because they're just running ragged from here. So I just think that would be a bad idea. Just in general, you want these checks and balances with things, and by having the sanitarian there verifying the accuracy of the the engineer's decision is a good thing for everybody. At the end of the day, it really is. And I think I would not support that. I think that would be a bad idea. I get it. It makes sense. Like you think, well, they can, sort of self-certify and all that. But I think you really, at the end of the day, everybody, the homeowner, the builder, everybody really, and even the engineer themselves appreciate this uh, sort of oversight to keep everybody in check. And I think it's important. I don't know if I would support that. And the thing that I mentioned earlier about staffing at the local health and seeing that a lot of the senior staff is retired, I've seen that actually in engineering firms too. And we're actually having to sort of I don't want to say train, but we're getting plans from these younger engineers that just don't have a clue. And we're having to sit down with them. So they're actually, it seems to me, experiencing the same problem with training as well. And I think what I would like to do is even some of our training that we offer, if we had spots to allow some of the engineers I was an advocate to attend, just because, myself being an engineer going through college, I mean, you don't really spend a lot of time on septic systems, to be honest with you. So they kind of learn on the job with the specifics of that. And if they could be part of some of our training, the same trainings that we allow the sanitarians in some cases, that might not be a bad thing because they're all learning from the same source. So that would be another possible recommendation for that. But I hate to say about that. I don't know. I wouldn't support that.
Yeah, I agree with you, Matt. I think we should definitely open this up for engineers to take part of the training. I think that's excellent. Because
Mhm.
you're right, when you're going through your PE license or schooling, you're learning
Mhm.
about everything from structural to, you're building a high rise to a bridge to a septic system to environmental stuff. I mean,
Yep.
if you spend a week on septic system, that's probably a long time. You probably don't. You probably might spend a couple of
Agree.
days
Yep.
in your overall schooling for that. So yeah,
Sure.
that would definitely be good. So I understand what you're saying about the second set of eyes on every set of plans, but maybe it was sort of going back to Matt's issue where you're designing, you're sort of getting this preliminary. A lot is suitable for a septic system. We're not really getting into the formal design, but we have soils, we have we don't have ledge issues, we don't have high water level issues, so we can put a septic here. We don't know exactly where it's going to go, what the size is going to be, that sort of thing, but they could self-certify something like that and sign off. That doesn't mean that you guys aren't going to get a crack at the final design, but especially when Matt's doing it for a conventional subdivision and an open space subdivision, like let's not waste your time on this just so we can satisfy a zoning requirement. But once we get to the formal design of the system, now it goes through the current process, which
Yeah,
is
that I could
two
see
sets
some
of eyes. That
flexibility.
might be something we could look at.
Yeah, I mean that would be more a call of the zoning people, really, because if they're the ones that are accepting that data, if they're willing to do that, yeah, I mean because that they're at that point they're the regulating entity because you're producing this for their benefit.
Yeah. And we as developers are kind of taking that risk. If we have our engineers say, yeah, you can, lot four is a qualified lot, it's okay. And then we
Mhm.
get to you at the end and we go, we got our lot approved, and you guys come in and go, you screwed it up because the water table, you misread the holes, or the water table's not right, or there's too much ledge, or you don't have enough area outside of wetlands or something like that. We're going to go back to our engineer and ream them out because they just screwed up.
Yeah.
They said we had a lot we don't have.
But
But
one
it's at
point,
our risk. We may have to make that judgment if we want to do that or take the extra time and pay a fee to have you guys review it for us.
sure. Well, one thing too, Bob, I want to make this clear. I mean, and I've seen this, a developer will go out with their engineer and do their own testing on their own. And so just to get an idea, and so you're allowed to do that. Now, whether the town, in some cases, let's say you had a bunch of tests, and they may go out and say, well, let's verify some of these tests, and let's say the site, again, this specific site, the soil tests are all the same. It's bank run sands and gravels. They may elect to accept. I can't say, this would be a case by case. Some of those test results, so you wouldn't have to go back out there. But again, I be careful when I say that, because they're supposed to be witnessing everything. But I'm just saying, maybe in a pit or two or here, there's hundreds of them and stuff like that. You can say, hey, look, we got a verification of this one. It's all the same. But yeah, so.
This seems to make a lot of sense to me for what I just went through. And, Matt, this is in your area. I think you're in charge of like Easton and the Aspetuck area down there. So I have 26 lots. I told you that story. Like, that took 5 weeks to do that testing. And I could have done all that testing if only my engineer had to go out with my excavator. I could have done it in a week and a half. Like, we would have worked 12-hour days. We would have just banged it out, and then we would have been done with it. But no, it took me 5 weeks, and it was a big burden on Aspetuck. That's where they weren't even doing the perk tests. We were doing the perk tests ourselves, because they're not going to stand around there and wait for everything. We're hauling this water bladder around, filling up holes and doing that, in parallel with while we're digging the rest of the things. We had a whole bunch of people out there. It costs a lot of money. And they were happy with the results, but it took 5 weeks to do what we could have done in a week and a half, just because, they have jobs, they have responsibilities, they have, somebody who wants their restaurant open, they have somebody who wants the school to be certified. They, all those things have to happen. And so like, it just took a big chunk of time. So it would definitely be something that I would love to see if we could consider, especially in the planning phase. You have a soil, maybe you say that the engineer has to have a soil scientist sign off on these, so now you have a soil scientist looking at all these. It's not going to save me money. It's going to save me time, because, that $165 a lot, $145 per lot that Jim's charging, that's short money compared to, the engineer that I have to hire, the soil scientist that's going to go around and check all these things for me. But if I can get it done in a week and a half or a week versus 5 weeks, that time is money to me. And that makes a lot of sense. And they have a certified letter from a soil scientist saying all these lots, not only perk right, but they also have, the following soil conditions. So Jim, you had your hand up.
Matt, you can save me. I want to make a radical statement here. The Connecticut Public Health Code, Section 1913B103, talks about individual lots. There's nothing in Public Health Code that I recall seeing that requires us to test subdivision lots for each individual lot. Mm-hmm. So if you want to go down that path, Matt, that technically we don't have to do anything until an individual lot is submitted to us. But we do have to witness soil testing. So if you submit a lot that there was 4 test pits on it already, we're going to most likely require to go back out there to that lot and conduct our own individual test pit or test pits to verify the soil conditions. So there's nothing saying that we need to be out there involved in a subdivision plan. I know that's a pretty radical statement, but I've had that in the back of my mind for for decades. So if you want to speed up the process, I don't know how that's going to get through any zoning or the planning commission, when they probably have in their regulations that they need health department's approval. But in reality, the public health code is set up for individual lots, not for multiple lots.
So then I have to go back and dig those test pits again when I go to build that house on that lot. So
because the public health code states that the director of health, or the authorized agent needs to verify, the soil test. Does verify meaning that, oh, I'll verify what's on writing? To me, verifying is you physically are out there on the property looking at at the soil.
I guess that's the question. What does verify mean?
Well, depends on if
Bob,
you go to Webster's Merriam Dictionary or another dictionary.
Yeah,
what
so
does relationships mean?
it's an interesting conversation. What if we were to suggest that a soil scientist could act on your behalf in reviewing it so that you wouldn't be relying on an engineer that may or may not have the qualifications? But if we brought a soil scientist in and they certified in some manner, so do we change, maybe that's to change the health code, but if that would be a way to get you guys out of it, put the onus on them to properly document it. And if you still feel comfortable that they would give you the right information so that when you're reviewing it, you're going to base it on their soils that says this was high water, or this was the restrictive soil layer or whatever. You're relying on their information, which you kind of are anyway, except I guess unless you do it yourself and you're qualified to do it.
And again, that's going to be a change in the public health code.
I'm
But
not opposed to suggesting that we change it if you guys are on board. I mean, I'm trying to understand. I mean, this has been really informative for me, just understanding the process. But I'm all about, why do we do it this way? How come, are there valid reasons, or are there things that we can do to simplify the process or take the burden off of you or someone else?
Yeah, and I honestly, I think that's a fundamental duty that the locals have. To be honest with you, Bob. I mean, the other thing, I don't think there's a state in the country that I'm aware of that doesn't have some sort of government entity out witnessing this stuff. I think it's important that they get out there. But I do. If you guys want to look at this so-called subdivision process that zoning or somebody else is looking at, then you need to go to them and say, do we need the health department to get involved in this? Can we have it? And then they can do it, because we're bound by the code, which I don't recommend changing to take them out of that. You do need the checks and balances. I want to answer Matt's question though. So and it sort of answered what I gave the answer to Bob a minute ago, was that, if you do go back out there, maybe you have 4 test pits on this property. Maybe I only need to do now one that the health department didn't witness. Maybe I only need to do one, because let's say they do one like in the same vicinity as these 4, they're sort of spread out in a grid pattern, and you get the exact same results as all 4 of them are. The sanitarian can use a little bit of discretion there, in terms of whether or not they want to accept the other ones. I verified by doing a test right in this area that's surrounded by these other test holes that all have the same results. Maybe we can accept that. So you might be able to cut down on some of the testing and not have to redo, but you will have to do at least 1 or 2, in that vicinity. And it's based on the consistency of results. But if you're getting ledge rock at all different depths and everything, unfortunately, they're probably going to have to do more testing. So
I like that concept a lot, Matt, because a lot of times, even when we do our full testing for a subdivision lot, and then we go to the site plan and somebody goes, yep, I want a 4-bedroom house, but I also want to have a pool in the backyard. And all of a sudden it's like, oh, we got to move the septic to the front yard. Well, we have testing at either corner of the front yard, but not right where the system would likely be. So now we just retest that spot. Again, it does come down to consistency. Yeah. If you've got soils all over the map, it doesn't make sense. But maybe in those areas where you have fairly consistent soils,
yes,
just give me one where you're proposing this new system. Jim comes out, or his equivalent comes out and checks that spot and goes, okay, I think we're good here. I feel comfortable. Or, geez, this soil's not what you show me in the other test pits.
Right.
Maybe we got to do a couple more here to figure it out and run a new perk, because maybe the soils aren't as good where we're proposing the system.
And that judgment call that we're discussing here, that falls back on my program to get the training out there, so these sanitarians know that that's a tool in their tool chest. You get these younger folks that they're like a deer in headlights with this. So they don't know how to make, and sometimes they're a little overly conservative. I mean, it's good to be conservative. I don't want to down that, but sometimes it's a little bit much. And so if we can get out there training, one other thing though, one other benefit though, by the way, guys, of having the sanitarians out there, and this is something that I have, like when I get an over 2,000, I usually ask that I see the soil test results. I don't spend the whole time there because when I'm looking at that plan, when I saw those results, that makes me feel better. And I often have less questions while I'm reviewing the plan, if I saw that with my own eyes. So there is some benefit to the individual, although that's not always the case at the town level. But most of the time, the same person that's doing the soil testing will ultimately see the plan. That's also helpful and helps them to a lot of times process the plan review faster because they've seen the soil test results. They're not going to question these things as much because it's like, I saw that with my own eyes. I get what the engineer's saying. So just want to throw that as well in the mix.
I love these discussions because like we're kind of identifying or picking away at like things that are, areas that we're not going to go into. This is too sacred. This is too important. We're not going to give up on that. And we're taking on ideas that we kind of need from our side. So like I think these conversations are great. And I just looked at the clock. I'm like, holy crap, we've already gone 56 minutes and we got through one page. But I think that we've teased out a lot of issues and we keep coming back to this one point that like training is going to be one of the biggest things that's going to help expedite the process and make everybody more comfortable. So next week we're gonna pick right up with the 2,000 to 7,500 and then the 7,500 and above. I really want to get through both of those, and hopefully we're going to get to go to your organizational your org chart and how you guys are organized and at PPH. So hopefully we'll get to that next week as well. Thank you guys so much. Matt, you got something?
Yeah, just one quick thing for the group. We have a code advisory committee and the building, but the home builders are represented, sanitarians, everything else. I would welcome these kind of discussions. We kind of don't have these as much anymore, so we can keep this going forever. For part of our code advisory committee. So you can give these topics and you can attend the meeting yourself as well, but your representative for the home builders that comes to our meetings could have a list of discussion points. And we welcome these kind of things because a lot of this stuff we can tweak in the technical standards. We don't necessarily have to make regulation changes, especially for, how we conduct our inspections. It's very vague in the regulations on how inspections are conducted and things like that. So there's a lot of wiggle room that we could, we could actually put in the technical standards. And if we get feedback from you guys, we can make that work without going through a regulatory process, which is very onerous.
You know who the representative is from the builders on the code advisory?
I can get that. Is it Jim Paris? I think it's Jim
I don't know
Paris.
if it's Jim or Dave Potts goes to those a lot.
Dave does.
And I've been to a couple of them myself,
Yeah.
but haven't participated a lot. So, but yeah, that's great. I don't know if I want to carry on this conversation forever, but a little more.
Sure. Yeah.
might be
Kind of a
good.
crappy conversation to have. Sorry, I haven't made one pun joke yet, and I had to do it. So go ahead, Jim.
I would go to those committees, but I'm too busy reviewing subdivision plans. Next Tuesday, I really would appreciate that we don't have a staff meeting because it's Veterans Day and
Oh yeah.
I'm off.
Me too.
I am a veteran and I'm not off, but I am in about 4 schools next Tuesday. So that's a really great point. I appreciate you bringing that up.
What branch, Matt?
I was in the Navy.
What part of the Navy?
I was a special operations. I was explosive ordnance disposal. So I was a bomb squad guy.
I was a CB for 5 years.
Excellent.
Thank you guys for your service.
Yeah, thanks, guys.
We can sit and yap about that.
Do you want to just skip our
Absolutely.
meeting
Sounds
next
good.
week, or do you want to try to do it Wednesday prior to the full meeting in the afternoon? Or what do you
What is
think?
the consensus of the group? Do you guys want to take a bye next week? I mean, I think we're probably safe taking a bye just because from my understanding, the other groups aren't as on schedule as we've been.
You are
Um,
correct. At least the one I'm in.
Yeah, I
You
think
guys
you're
are-
right, Matt. I think we can maybe just skip it, and we're not going to fall behind where they're bringing us. We need their feedback before we can start saying what rules need
really
to
putting
change and
pen
what
to
fees are going
paper.
to change.
Yep.
Yeah. So, all right, guys. Well, that sounds good. Happy Veterans Day to everybody. I appreciate it.
Yep.
And
Thank you.
we'll see you guys on the big screen next Wednesday.
Take care.
Excellent.
Bye.
Thanks, guys.
All right, guys. Take care.
Thank you.